Recording in progress.
Thousands of people in Latin America and the Caribbean do not have access to quality, affordable healthcare. Many diseases can be treated, controlled, and prevented. Unfortunately, drugs, vaccines, and medical devices don't always reach those who need them most. But communities are finding solutions to make healthcare better and more affordable to people. Welcome to a special edition of Ask the Expert. I am your host for today, Tanya McFall Major, and today we will focus on the Social Innovation on Health Initiative 2021 call. Let's meet our panel today. Welcome with me, Dr. Luis Gabriel Cuervo, the Senior Advisor for Research for Health here at the Pan American Health Organization.
Hello, good afternoon. I'm delighted to join our friends in social media.
And it's
thanks
a pleasure
to Bajo Caribbean for the invitation.
And it's a pleasure for you to be here. We also have Dr. Jacqueline Alger.
Hello, everybody. I am here from the University Hospital in Honduras.
Thank you, Dr. Alger. And we have Dr. Manuel Espinoza, who is the Social Innovation in Health Initiative 2017 Social Innovator Reward recipient. Welcome, Doc.
Hello, I'm sorry for my bad connection, but I'm currently in the field. Thank you for having me here.
Thank you all so much for being here. We're looking forward to another provocative session, informative, educational, and entertainment. We like to put it all together to get the message across. But before we get into the gist of it, I want to open up the question to the entire panel. What is social innovation for health?
Well, I can answer that question, Tanya. Social innovations are simple solutions that are solving systemic problems in a very innovative way, in a creative way. These solutions could be services, technology, could be processes, policies, or even could be social businesses.
Mm-hmm.
Social innovations are developed together with the communities, and they are implemented with a variety of organizations, actors from different sectors. Importantly, social innovations are identified by their effect. What they do is that they make health services more equitable. They also enhance social inclusion, empower communities, and they strengthen the health, but also the social system. So those are social innovations.
Thank you so much. And Dr. Manuel, you said that you are in the field as we speak. What type of project are you working on?
Well, right now I'm actually coming from a workshop where we have meet a group of representatives from ministries of health to speak about their informatics and health systems. So how we can expand it to remote areas where internet access is so difficult. But yeah, we're taking a good steps towards connecting these communities. So yeah.
That's excellent. And based on what you've seen, how has what type of impact has your work had on the community?
Well, it's been a great journey from when we started. It was basically an idea between some friends that we were facing some challenges in our rural clinics, and being able to work with CHI and how they make you structure your ideas in a scalable way. The sustainability is very important for CHI. This has made us scale our ideas to not just focus on small rural clinics, but now we're serving many departments in the country, and basically for this COVID season, we had the opportunity to work with a lot of different groups, because we were already having the experience of working with digital health in difficult contexts. So yeah, that had led us to serve more people than we initially thought we were going to.
That's excellent. And of course, we're calling for more persons from Latin America and the Caribbean to come to the forefront to bring their ideas so we can help the persons to get the health systems, to help anything that's to help the community on the whole to improve our health systems at large. And so we want to welcome again everyone who's listening via Facebook, Twitter, whichever social media handle you're on. And we ask that you share the information with your family, your friends, and your loved ones. And also to stay tuned to find out how you can apply and you can be a part of this global initiative that we're focusing on, social innovation in health initiative. So let's get back to some questions. We have some questions you want to talk about. We'd love to hear from you. So if you have a question, post it on the platform and we will answer it here on our session today. So Dr. Luis, please tell us why Social Innovation and Health Initiative, or as it's called, SIHA, that's supported by PAHO, it's supported by the International Center for Medical Research and Training, it's supported by the CDIM, and all of these other institutes, including the university, the National Autonomous University of Honduras. Why are all of these persons partnering? And why is it so important that we explore social innovation for health?
Well, thank you very much, Tanya. Well, the reason why we have come together to support this is because we have the data and the knowledge showing that the value of social innovation in improving access to health services, to improve the quality of the services, and to have better social participation in the decisions that affect communities. Mm-hmm. So that is really the motivation. And since 2014, the Social Innovation in Health Initiative, or CHI, as some call it, has identified many innovations and recognized more than 44 innovations in 17 countries. And all those have been studied by the group that supports this. Of these, 8 social innovations occurred in Latin America. And were studied by the CHI node for the Americas that's called CHILAC. Actually, there was a call in 2017 that was also for the Caribbean, and we didn't have really that many applications. So we are hoping that this time we have very good applications from the Caribbean so that we have some of those recognized. Now, the study of these recognized innovations has allowed us a better understanding of the impact that they have on the health systems and on the people and communities and on how they work and whether they can be expanded or adapted elsewhere. So based on the study of these innovations over the last few years, we have seen how the social innovations have come to also benefit and empower the most marginalized people and communities, people in isolated or remote environments, or those living in situations of vulnerability as well. So we have learned from how innovations have been scaled up in various countries and how they have influenced policy. That's the main reason for our engagement.
Thank you so much. So as you heard just now from Dr. Luis, we have not had many projects from the Caribbean that have been taken on. So what we're encouraging persons, take the opportunity, look on the link will be added to the social media handles, make the application, apply. You do not know what can happen. And of course, we want more projects from the region because we need to be able to get the vaccines. We need to be able to get the medical devices and medicines on the whole to persons in different places. So going back to what you mentioned earlier, you said that there have been about 4 social innovations in 17 countries. Can you give us a few examples of those?
Yes, out of the 44 social innovations, there's some that are very striking. I have a present one that's called, for example, Mamás de Rio. which brought, they work with community health workers in the Amazonian basin and training these, supporting these people so that the women could get adequate medical treatment or controls during pregnancy. And then for the children to be looked after as well once they were born. And now that runs incredibly well. It has grown so much that it's now a binational initiative that covers over 750 kilometers of the rivers in the Amazonian basin. And it's not just in Peru where it started, but now also in Colombia. So that's an example, but there's so many other more, improving the way that transportation is serviced to health centers, for example. So there's many, and all those stories you can find in the links, because not only you have the case studies, but you have also short videos that tell you about each of those stories, and you can find in the links that you have in the social media.
Thank you so much. And if you're just joining on, we're encouraging you to share the information with a friend. If you are a healthcare worker, if you do research for healthcare, if you have a private business, we're calling all of you, all persons, every part of the community, regardless of your background, to get the information, to sign up, the information will be shared. We're calling for all persons to help with this change, to be innovative for healthcare in the region. Dr. Jackie, tell us why social innovation is needed now.
Well, we mentioned before, social innovations for health not only improve health, but also strengthen the social system. So if we have a problem, there is several ways to approach this problem, but when these systemic problems are approached using innovative, creative ways to address this problem together with the community, that empower the community. And that's really something that produces a more equitable health services, also strengthen the social system, as I said. So there are so many reasons, so many wins to obtain from this social innovation. And we will hear more when also Manuel tell us about his example of a Mosquito Man.
All right. So thank you so much. So I'm going to open this up to the panel. Does this mean that you're looking for solutions that directly address COVID-19, or are you just looking for solutions for the health system as a whole?
I'm happy to address that question, Tanya. We're looking for solutions that during the COVID-19 pandemic have supported health systems to continue delivering to the people they work for. Therefore, we are going beyond the healthcare provided to people with COVID-19 to include all health services provided during the COVID-19 pandemic. And we are also including innovations that address the social determinants that affect health. The focus of the call is on social innovations that support the continuity of the health service and access to them under these circumstances. And these innovations are frequently developed by innovators based in communities, in villages, in universities, doing work across countries or even between different countries. So we are looking for projects that must have been active also during the time of the pandemic.
Okay.
Yeah, it is, for example, I mean, the projects could have existed from before the pandemic and adapted during this time to continue operating or enhancing the way that services are delivered, or could be a totally new project. That's also fine, as long as they have been implemented for at least 6 months, counting back as from the 1st of June. So I would say as from December, early December 2020. And the project innovators or creators do not need to be from a country in Latin America or the Caribbean. However, the project must be implemented in a country of Latin America or the Caribbean, and with the participation and engagement of the local communities. And all projects will be assessed by an independent panel of international experts.
That is exciting. So persons that are listening, you do not have to be from Latin America or the Caribbean, but once you have a project that can be considered, send it in. Send it in. Let's change our region. But I want to go back to something you mentioned. You mentioned that the health services could have existed prior to COVID-19, the pandemic. And you mentioned that it should address social determinants that affect health. What are these social determinants? Maybe persons that are listening, they may not know what the social determinants that affect health. So can you explain that for us?
Well, I'm happy. Yeah, there's many factors around our life that affect our health. And I think there's a beautiful example from a social innovation in Guatemala, where the innovators worked at improving the housing of people, and by improving the way that the housing was maintained, or the finishing of the walls and the floors, they managed to get rid of Chagas disease. And that was, so here we're talking about housing. Some of the other projects about transportation, having clean water, all these other factors that affect our health, or issues related, for example, to having quality food or improving the family income, because we know that poverty has an impact in health. We know that having food that's not of good quality is going to impact health. So all these other factors that influence in health, but are not directly within the health system.
That is excellent. I know that our listeners are excited and they want to find out more information. Can you tell us the website where we can find the information?
Yes, so the links will be shared with you. So take a look after that. I can explain how you can participate. Be aware that the deadline is July 9, so a week from now. So pay attention, that is at midnight GMT, the timing. So this is important because, if you can participate with internet through download a form from internet, or you can do it online. So you will see the links over there. If you download the form, you can send it by email. The email information, the email address will be shared in the networks. It's important that you take a look with enough time to the form, because it is not complicated, but it takes time, because you have to give all the details so you can show up all your creative work. Then don't do this at the last minute, because internet can just crash, and so don't leave it to the last minute. You do it early. Be familiar with the form, and these forms are very has a lot of information, guiding information. The forms are in Spanish, English, French, and Portuguese, but the proposal can just be submitted in Spanish and English. So that's our advice. Take the time to get familiar with the content, and then introduce all the information, and you send it online or offline.
Everyone, you heard Dr. Jacqueline. Start looking at the application today. It is due next week at 12 p.m. So start today. Use this weekend, but get some time out. Use this after you have a nice, healthy walk around the park. You come back, relax yourself, review the form, get the information, become familiar with it, so we can get that and you can meet the deadline. So Manuel, let's go back to the project that you are spearheading. It's called Mosquito Man. Tell us a little bit about that.
Yes. So Mosquito Man is the name Mosquitia comes from this area that is probably the most remote area in Honduras, where I did my social year in med school. And here we faced a lot of challenges because the access was just so difficult, and we didn't have a way to send our patients. So we have to be creative and innovative to find a solution for them. So at the time that we implemented our intervention, that was self-funded. Like it was basically a group of friends, medical students, that we were trying to move this forward. And at that moment, we were desperately finding, looking for opportunities to make it sustainable. And that's when we saw the call for Sea High Social in 2017. And the time that we were awarded, our project was struggling to become sustainable. And SIHA Award gave us the boost that we needed. It gave our project the recognition and legitimacy that SIHA lacked, sent through a researcher to put up like the case study for our project. We worked closely with them, with the SIHA hub in Colombia, to learn how to address some of the gaps in our project. And we and other innovators, we also were able to participate in exchange of experiences with especially a workshop that SIHA structured that was for design thinking. That gave us a lot of tools to structure our ideas and make it more attractive for investors. Well, these meetings with and connections with philanthropists, other entrepreneurs, and the network itself gave us a lot of recognition locally. So now our project has been merged with another organizations, among them from some academic organizations and some part of the Ministry of Health. So now we can expand our services, not just for La Mosquitia itself, but it's now countrywide. So like I said at the beginning, we never imagined that this could get to that level. But thankfully for the recognition that we got from this call, now we have a project, an official project that can hire people, that gives job to the people, but also we can impact in a lot more people than we initially expected. So yeah, this is a great opportunity that I would like to share to other people like me. You don't have to be a doctor. You don't have to be even a med student, which was my case. But sometimes it comes from the community itself. So if you're doing something different, problems are everywhere. If you're doing something to solve it that no one else does, maybe you are an innovator and you deserve the chance to try your ideas and make it grow.
That's excellent. How did you, I understand that you're grateful for the recognition, for the new partnerships, but when you got the call or the message that you and your team you are the award recipients, how did you feel?
I mean, it made me feel great. Our team was very encouraged, because at that time we were like, well, disappointed to see like there's that. I mean, we know this can work, but no one recognized it itself. Like this could potentially be a solution, because everywhere we went, it was like, no, that just doesn't work here. Technologies so far away. But in reality, what we did was like taking what we had there locally and connected with a wider part of the system. What Dr. Jackie was very well on that point, that we, and as social innovators, we just not go with our own projects. We become part of a structure of a system and strengthen the system. That sometimes the government cannot have this opportunity to innovate because they have to make it already scalable to a countryside. So they don't have the opportunity to experiment. So that it was nice, because from that moment on, more people started listening to our pitch, and we could join wider groups.
Well, congratulations again, Dr. Manuel, and we're hoping to see more persons, not only from Latin America, but we're hoping to see projects from the Caribbean that are really going to shift the way that we do things and really improve our health systems. But as we prepare to conclude, what final messages would each one of you want to leave with the persons interested in participating in the 2021 call or even future calls?
Tanya, I can take that. We have a very good team ready, a support team, ready to guide, to answer questions, to solve problems. So look for the email address. And if you have any question, any inquiry, please write to our team and they will guide you. They have a lot of experience and they can solve any problem that you may present. And remember that all the information is in the SIHI, S-I-H-I, LAC, Latin American Caribbean platform. So look for that www address so you can find there the way to fill out the form online or download the form and fill it offline and send it in by email. Please, if you have a solution, if you face problems during this pandemic and you try any solution, please let us know, participate. We welcome all the participation from the Caribbean. We want more participation from Caribbean. Thank you.
Excellent. Anyone else would like to add in? Dr. Luis, Dr. Manuel, your last words?
Well, I could share some thoughts, Tanya. Thank you. I would just say to everybody that's thinking or doubting, should I do this? Don't underestimate the power of your ideas. Sometimes we think that a small group of people cannot change the world, but in reality, most of the big changes have come from small groups of people joining together. So come on, go ahead, don't be afraid, and good luck.
Thank you, Dr. Manuel. Dr. Luis?
Well, when I've been doing my field work in the Caribbean, I always see so many amazing things that are happening, that people are coming together to do them, that I just want to reinforce the message from Manuel and from Jacqueline, that there's so many opportunities here, and that there's the opportunity of building on this platform of the Social Innovation in Health Initiative to get new skills, to develop opportunities for your work locally to grow and to have impact, more impact than it's already having. And that's a great opportunity. So we look forward to your applications.
Thank you so much, panel, for being with us and sharing. And again, we want to remind persons that are just logged in to apply for the Social Innovation in Health 2021 call. If you are a healthcare worker, if you're not a healthcare worker, if you do research, if you have a private business, if you have an idea that can help to reform and to change and to improve the health systems and getting the supplies needed to persons in various areas who may not have access to it. This is the opportunity for you to get the funding, to get the support, the technical support that you may need to bring that dream into reality. And so once again, thank you everyone for sharing this information. And we hope that many innovators from the region, especially the Caribbean region, will participate, and we'll have so many solutions that you don't know which one to pick. So we want to thank you again for connecting with us. Those who are watching on our various social media handles, Facebook, Twitter, Instagram, wherever you are, we want to always encourage you to visit www.paho.org and follow us on our various accounts. And we look forward to speaking with you next time. Thank you and see you again. And before we go, we'll have a quick video on social innovation in health initiative. Bye-bye for now.